here, I've been helping people with kidney problems for almost 10 years now, and I've met people who were able to reverse kidney disease. All of them had to find a way to get a balanced vitamin intake. There are 3 vitamins, just 3, that are crucial to do this. You cannot heal your kidneys without them. Fact: your kidney function is never going to improve if you don't have the right levels of the vitamins I'm going to show you in today's video. So today we are going to see what the top 3 vitamins you absolutely need are. Our number 3 in particular has been proven capable of slowing down kidney disease. Number 3 is, let's see what's inside. Vitamin C. Vitamin C is widely known for its function as an antioxidant. It actively improves immune health and protects the kidneys from oxidative stress. And it also plays a crucial role in wound healing, bone and tooth formation, and heart health. Of the 3 essential vitamins for people with kidney disease we are going to see today, vitamin C is the most powerful when it comes to fighting anemia. And this could give you an immediate kidney health boost. This is because anemia is extremely common in CKD and it's a known cause of kidney damage and even death. So take vitamin C possibly during a meal rich in iron. The most well-known source of vitamin C is citrus fruit, but you can also get vitamin C from strawberries, green and red bell peppers, broccoli, Brussels sprouts, and kiwi fruit. But in many cases, it will be better to also supplement this key nutrient. Actually, there is even a recent study suggesting that supplementing it in the right dosages may help remove uric acid from the kidneys, protecting them and lowering the risk of gout. All these benefits can be obtained by supplementing vitamin C in a low dose because vitamin C is excreted by the kidneys. Intake greater than 100 to 200 milligrams per day should be avoided by people with CKD in stage 4 or 5 to avoid oxalosis, which is the accumulation of metabolic byproduct of the vitamin C. Now, very important, vitamin C also comes with a hidden danger. The vitamin C supplement in your medicine cabinet may actually be causing your blood pressure to rise instead of lowering it. Yes, not all brands of vitamin C on the market are safe. I've explained all you need to know about this key vitamin in my video up here. Watch it now to know more. Before I show you the next vitamin, this one is our number 2 because it can significantly reduce the severity of proteinuria among patients with CKD. There is one question that needs an answer. Can taking vitamins really help lower your creatinine levels? I know that a lot of people don't like taking too many supplements. I get it. You're probably taking enough pills already. But the general consensus today is that people with kidney problems need to take the 3 vitamins of today's video. The reason is that patients following a renal diet are way more at risk for vitamin deficiencies compared to the general population. Many of the medications that kidney patients take, and there are quite a few, may block the absorption of key vitamins and minerals. Based on the most recent studies on the subject, most experts and national medical groups are recommending people with kidney problems to take vitamin supplements daily. The National Kidney Foundation also took a hard look at multivitamins in kidney disease and agreed that people with kidney disease are more likely to develop deficiencies in many vitamins. So yeah, it is scientifically proven that you cannot heal your kidneys without these 3 vitamins. Now guys, if you still have any doubt, feel free to ask in comment section and I will try to help. Okay, our next answer is a vitamin that can literally save your life. Number 2, vitamin D, the kidney vitamin. This vitamin is routinely prescribed to kidney disease patients to help preserve their bones. Seriously, consult your doctor if you're not taking it yet. And it also has some impressive and underrated benefits. In a recent study, vitamin D significantly reduced the severity of proteinuria among patients with CKD. Proteinuria is one of the most important indicators of kidney health. Reducing proteinuria means directly slowing down the progression of CKD. Also, kidney disease patients with the higher levels of vitamin D are considerably less at risk of dying from cardiovascular disease, the #1 cause of death in the world. Not to mention that it was recently proven an association between low serum vitamin D levels and a faster decline in kidney function. And you cannot get vitamin D in high enough concentration from basically any food. Yes, supplementing this one can save your kidneys and your life. And since vitamin D is so popular, it is also very easy to find, since the needs of the people with kidney problems are similar to the general population. You can probably buy this one at the supermarket too. Commonly recommended dosages in all the stages of CKD are between 600 IU and 1000 IU. There is just one thing you need to know before starting to supplement vitamin D. When supplementing alone, vitamin D may cause calcium to accumulate in the arteries. Absolutely not something you want. But if you supplement this vitamin in combination with one key mineral and one supporting vitamin, it can change your life. Because now you will feel more energized during the whole day, and all the extra calcium this vitamin is letting your body use will go straight to your bones and not your arteries. This is how you repair your kidneys. I've explained the best strategy to achieve this in my video up here. Watch it now to know more. And obviously, consult your doctor before supplementing anything. But the vitamins I show you in my videos are safe to supplement in the right doses. Our #1 is, let's see it. Ooh, #1, vitamin B. Okay, this is not technically just a vitamin, it's a group. But you will usually find all B vitamins in a single supplement. And most importantly, all the B group is essential. Here's why doctors and researchers think this group of vitamins can really help lower your creatinine levels. Folic acid, also known as vitamin B9, is involved in the production of red blood cells. And people with kidney problems really need more red blood cells. Anemia is extremely common and dangerous. Vitamin B12. Just like folic acid, vitamin B12 can help fight anemia. It's also crucial to fight fatigue. Some people consider it the energy vitamin. Vitamin B6 is frequently too low in people with kidney problems, and it's crucial for the nervous system and immune system. Vitamin B2 or riboflavin boosts the immune system and fights headaches. Vitamin B3 or niacin helps with cholesterol. B5 fights stress. B7 lowers blood sugar in diabetes. And I've kept the best for last, vitamin B1. This one is crucial for energy production, and it's also needed by the nervous system to work properly. And according to a study, taking B1 in high doses can protect the kidneys of people with diabetes from damage. Diabetic patients in the early stages of kidney disease treated with high dose or 300 milligrams of vitamin B1 for just 3 months saw a return to normal urinary albumin excretion. This means that their kidney disease actually regressed and their creatinine was immediately lower. And guys, you know that there is one superfood that's so rich in these vitamins, it can actually help you lower your creatinine even if you only eat it in very small amounts. Want to know more? Watch my video up here. And this is all for today. Thank you for watching.